Hi, everyone. Welcome. I'm here today with Dr. Bixler, a licensed psychologist here at Mayfield Counseling Centers. And today we're going to be talking about psychological evaluation.
It's time for your Monday Minute.
So when we hear the phrase psychological evaluation, that can be a really intense, scary kind of phrase. I would love for you to explain kind of what psychological evaluation is and maybe what cases that we would want to seek out evaluation.
Sure, absolutely. I think this is one of those topics that I think has entered in the modern colloquial as we understand more and more about mental health, and the public becomes more and more accepting of mental health. As always, I think there's translation errors.
Always.
Right? Always.
Yes.
For me, when someone says psychological evaluation, ultimately what we're talking about is an umbrella of a lot of possible things. The goal is ultimately, how can I get information about a client or anyone who's coming for help for mental health that informs what's the best way I can help the person in front of me. And really, psychological evaluation is things that we do to give us more information about how to help you, ways of gathering information. Most often, that is probably what people think in a systematized assessment way. Not always. I think most good psychological evaluations include data points about clinical interviews, talking with your families, gathering your history. I think that's a really critical, important part of psychological evaluation. But really, I think what I'd like people to take away is that ultimately it's a way of trying to find the most efficient ways to help you, the individual in front of us. What seems to be going on with you, and how can we best help you? Rather than sort of meandering through weeks and weeks and weeks and weeks and weeks of gathering information in kind of a holistic, organic way, sometimes what is better for people is to be more focused and targeted and intentional. And that's really what a psychological evaluation is, a focused, targeted, intentional way to gather data that tells us what might best help you with why you came in. That's it.
Oh, that makes it sound so simple.
It's very complicated.
Yes.
But it's not scary.
And I think that's so key because prior to even going into my education for mental health, whenever I hear psych eval, I'm thinking someone's strapping electrodes to your brain and sitting you in a chair and are asking these really important questions or, just really taking this deep dive into who you are as a person. And it can seem very invasive.
It's very direct. It's very time sensitive. That's the way I would talk about it. It can seem invasive. I think you have to prepare yourself. Do I want this to be time sensitive? Is why I'm here time sensitive to me? If it is, I think psych eval can be a really, really important thing.
Absolutely. I think many of our clientele come in looking for answers.
Yeah.
And we can spend years trying to find answers to some of the questions they're coming in with.
Absolutely.
And we may still miss so many of the things they're looking for.
Yeah.
But an evaluation might be a really great tool for us to be able to provide answers, like you said, time sensitive in a quick manner, be able to cover as many aspects as possible at the same time.
Yeah. I think that's it. I think being a little more relatively speedy in our evaluation.
Right. I was like, okay.
So don't be intimidated by it. If it's something that's suggested to you by a clinician or a therapist, I don't think what they're looking for is to be invasive. I think what they're looking for is, how can we do this in a more targeted way that is sensitive to your time?
Yeah. And ultimately, if you're coming in for counseling, we want to be able to provide you with the best tools possible to live the most, successful, least impaired life that you can have. And if this is a really great tool to get to that goal, don't be afraid. And hopefully, if you have a great relationship with your clinician, be able to put a little trust in them to be able to go out and have those evaluations so that we can ultimately find the answers you need to be able to move forward with your life.
Or even the interventions that will help you the most effectively. You, the person in front of us, I
Yeah.
think a lot of people are like, oh, you're going to categorize me.
Right.
Actually, what we're looking for is like the most nuanced picture so that we're
Yeah.
not just picking an intervention that works for most people most of the time. We're getting at the intervention that's way most likely to work for you.
Yeah. Well, thank you so much, Dr. Bixler, for coming in and talking about this kind of mysterious topic of psych evaluation. And thank you all. I hope you have a great rest of your week. Hope you have a relaxing weekend. And I look forward to seeing you next week, Monday, for our next Monday Minute.